Hello, everybody. Thank you for joining us today. We're going to talk about the OpenRN project as we're coming to a close. With me today is Kim Ernstmeyer, the project director for the OpenRN project. And my name is Vince Mussehl, and I'm the lead librarian for the OpenRN project. Our learning objectives today are listed below. So by the end of this session, you should be able to describe the OpenRN project and associated spin-off projects, explain how to access OER created by the OpenRN project, plan how to incorporate OpenRN OER into your curriculum, and describe how the OpenRN project has incorporated cultural responsiveness into OER. And Kim is going to talk a little bit about the background of the project here.
Thanks, Vince. So for those of you that are aware of the OpenRN project, we were granted $2.5 million in 2019 from the Department of Education to create 5 nursing OER textbooks. And we're thrilled to share that all 5 textbooks have now been published. So that includes nursing pharmacology, fundamentals, skills, mental health, and management. 4 of the 5 textbooks are now available as print versions through our print publishers and the mental health textbook will be available in print version in January of 2023 in college bookstores and on Amazon. In addition to the textbooks, we also created 25 virtual simulations using H5P, branching scenarios, and interactive books, as well as 25 immersive virtual reality scenarios using a software called Acadicus that can be students can participate in using the actual VR headsets, as well as viewing it online via screen broadcasts, such as this. To create these textbooks and virtual simulations, we've had over 300 reviewers from across the country participate in peer review process. We've had faculty from all 16 Wisconsin Technical College System colleges involved, and 65 contributors from both academia and industry. So we have nursing faculty, we have registered nurses currently working at the bedside, we have librarians and nursing students all participating in creating these resources for students. Now that all 5 textbooks have been published, if all 16 Wisconsin Technical Colleges adopt all 5 textbooks, we project that 5,700 students every year in Wisconsin alone will be impacted, saving over $1.5 million annually. So really excited as we look forward to the impact of these textbooks. And as Vince will talk about later in this presentation, we've also trained over 200 faculty and administrators as OER champions. So not only are we scaling OER across nursing programs in Wisconsin, across the country and around the world, we're also scaling that across other programs in addition to nursing. So it's really exciting to see the usage numbers now internationally. So this is a screenshot of our most recent Google Analytics data. You can see almost 1.7 million users internationally have viewed over 4.3 million page views of these 5 nursing OER textbooks. And on the next slide, you can see how that breaks down across different countries. So United States, about 46% of those users, and then the next top 4 after that are the Philippines, India, Canada, and Australia. And then it goes from there. So really exciting to see how this is impacting nursing students around the world. As we know, COVID has had a dramatic impact on the nursing shortage in America as well as around the world. So the more students we can help be successful in graduating and becoming nurses, the more beneficial this becomes for everyone in all of our communities. On the next slide, you can see the colleges that have officially adopted OpenRN textbooks, meaning they have purchased affordable print versions from Xanadu, and we're tracking it that way, in addition to the usage of the online textbook. So 75% of the Wisconsin Technical College System nursing programs have adopted it, as well as 44 programs across the US and Canada. And just looked at this, calculated this, and that includes over almost 50% of the states in America. So really exciting to see how this is impacting students everywhere in the country. So let's talk more about the impact. During the first academic year, which was 2020 to 2021, that was the first textbook, Nursing Pharmacology, was published and adopted by several colleges in Wisconsin that year. And you can look at the data here on the slide that compares all courses in the Wisconsin Technical College system in pharmacology versus those that have adopted OER, which are in green. And if you look at the very top line for the cumulative data, you can see there was a 5% higher student success rate in the pharmacology course using OER, using the OpenRN textbooks compared to all the other sections. So really exciting to see the impact that we're seeing on student success in completing this difficult course that they take in their first semester. And we'll continue to gather data throughout 2021 to 2022 and 2022 to 2023 and look at the trends across all 5 courses. In addition to looking at student success rate, we also have a survey that's embedded in the textbooks. And we ask faculty and students to rate the textbook compared to a traditional textbook in terms of quality, cost, ease of use, helpfulness of learning activities, inclusion of current evidence-based practices, which is very important in the nursing world, navigating to other valid, credible sources of information, which we've learned has become very important over the past few years as everyone is learning what's credible and what's not credible out on the internet. And then applying this information to patient care, which is the ultimate use of these textbooks as students learn how to provide care to patients. So in all of these criteria, 92% or more of the respondents rated the OpenRN textbooks as the same, better, or much better. As you can see, as the colored lines get longer and longer as we go down here in the graph. So good to see how those results compare to traditional textbooks. For the virtual simulations, we also include a survey, and I included a QR code here in case you want to take a quick peek at one of our virtual simulations. And the most recent simulations that we're creating, we're putting into case study format that mimics the next generation style case study questions on the NCLEX. And for those of you that aren't nurses, the NCLEX is the board exam that students and graduates must take in order to get their nursing license. And so these case studies really incorporate what's called clinical judgment and assess how well students are able to apply the knowledge that they're learning in the textbooks to actually caring for patients and making decisions as patient status changes. So if you want to take a quick look at one of those, you can scan this QR code or use this link to see the H5P activity. This survey that we've included in this virtual simulation, we've had over 626 respondents. Almost 95% of those respondents are students. And we asked several questions. And a few of the questions we included here in the presentation. First one is, the videos and images increased my interest in completing a case study compared to a traditional case study. And you can see 90% strongly agreed or strongly agreed that that's the case. 2 additional questions on the next slide are refer to the accuracy, currency, and relevancy to practice of this scenario. And again, 93% agreed or strongly agreed that is true. And then what we're really looking at, as I mentioned earlier, was the development of clinical judgment as a result of these case studies, and 94% agreed or strongly agreed that the scenario encouraged the development of clinical judgment. So great to see these results. Some of the qualitative feedback is keep them coming. Students really enjoy these small 10-minute or so activities that just to help them apply the content to patient care. All the media that's included in the virtual simulations is uploaded in our OpenRN YouTube channel. The hyperlink here on the slide will take you to the channel. We've uploaded over 140 simulation videos that include simulated patients, family members, nurse handoff report, interprofessional communications from other members of the healthcare team. They're very short snippets. Very few last more than a minute or 2. And you can see here with the analytics, we've had over 334,000 views of these videos with over almost 3,000 hours of watch time, and we have 598 subscribers. So every time we add a new video, the subscribers are immediately notified, and they can then use that video in their own learning activities. So another free resource that's available for faculty. Now Vince is going to talk about the impact of the OER 101 course.
Yeah, so as Kim mentioned early on, we've impacted quite a bit of administrators and faculty outside of the nursing field as well. So we did this because we knew we had a lot of stakeholders and not everyone knew the importance of OER and the value that it can bring to students and to institutions. So in order to help educate and advocate for this, we created a completely free online course that's 10 to 15 hours. We call it OER 101. And in this, the participants, who are primarily faculty, really learn about the who, what, where, when, why, and how of OER. And they have some short activities and then a summative assignment at the end where they create an action plan for maybe their course, or if they're an administrator, maybe how they can support the effort at their institution. So we piloted this course in January of 2020, right before the pandemic. And since then, we've had over 250 participants from a variety of disciplines, with the majority in nursing, of course. 83% of these participants have been faculty, and the rest again have been participants such as deans or instructional technologists or designers or librarians. We've even had higher management as well. We sent a follow-up survey in March of 2021, so last spring, and we received a 34% response rate out of the 160 respondents. And we've learned that 73.5% implemented OER strategies in the classroom since taking that course. And almost 25% were not quite there yet. Maybe they had just taken the course or they needed a long term, such as the summer, to work on things. We also learned that since they had taken this course, they've implemented over 78 courses that use OER, affecting over 4,000 students. And they self-reported and estimated this at a savings of over $550,000. And we've had participants from all over the country and a couple other countries as well. And you can kind of see some of this representation on the map listed below. So overall, we've had some great success in educating and advocating for OER.
We should mention we're continuing to offer the OER 101 course, so we'll talk later about how you can access it if you're interested. We also wanted to take a few minutes just talking about how we've incorporated cultural responsiveness into our OER. As I mentioned earlier, we have a variety of peer reviewers from diverse backgrounds across the country. We really rely on that diverse feedback as we make our final revisions before we release the first edition. So that feedback from the diverse population has been very helpful in just adding additional perspective and voices into the OER. We've threaded several concepts throughout the textbooks, the 5 textbooks of the Open RN series. So nursing in itself is based on person-centered care. So, concepts related to that, we really focus on cultural humility of the nurse and the nursing student, and being responsive to those individual cultural beliefs of every patient. Every patient is an individual, and we consistently talk about respecting those beliefs and pulling those beliefs into their plan of care. And that's really what nursing is all about, is advocating for that cultural responsiveness. In the actual textbooks, we use they, their pronouns throughout all textbooks. We focus on social determinants of health, so those other things that impact a person's health besides just the disease process, the environments in which they live. We talk about how nurses can advocate for and promote health equity despite these different social determinants of health that can create barriers to healthcare. And so from the very beginning, the very first semester of nursing education, we talk about these considerations, these cultural considerations as we provide care. If you're interested in looking at specific chapters in our textbooks and the Nursing Fundamentals book, there's a chapter called Caring for Diverse Clients that talks a lot about these different cultural components of care. In the Mental Health and Community Concepts book, we talk about vulnerable populations, specific vulnerable populations such as veterans, the elderly, people that live in rural America, migrant workers, etc. Human trafficking is a big topic too. And then, like, as I mentioned, advocacy is a big part of nursing education. And so there's an entire chapter in the Management and Professional Concepts book on advocacy. So let's look at some of these resources. So the best place to go to access these resources is our website, www.cvtc.edu/openrn. On the website, you can see the top here. You can access the online books. So all 5 of these books that are hosted in Pressbooks, you can get to from the website. You can also download the free downloadable PDF print versions of these textbooks. So I mentioned a little bit earlier, we work with Xanadu to create the affordable print versions, and they supply that free edited PDF that matches their print version. So the content hasn't changed, nothing else has changed in the print version except that it's edited to be fewer number of pages than the free downloadable versions within Pressbooks. So those are also available on the website. Something else that you can link to on the website would be the virtual simulations or the free virtual reality scenarios. I also wanted to mention that the textbooks are uploaded to LibreTexts. What's nice about LibreText, which was another one of the Open Textbook Pilot Grant awardee winners, is their remixing tool, which you can see in the gray banner here, kind of near the top of the screen. So faculty can take content from not just the OpenRN textbooks, but any nursing textbook, or maybe a nutrition book or some other OER book that they want to pull into their own book and align with their curriculum. And the remixing tool pulls that content in, renumbers the tables, the figures, and creates new page numbers, and you can press publish and you have your own OER textbook. So that's a nice option. Another thing that we rely on LibreText for is our virtual simulations. So those are all created in H5P. They all have CC BY licensing. They're embedded within the textbook, so they can be accessed there. But this is a nice way to look at the entire collection and download it there. We can also track the data that way too. And some things that we have coming up here. Some spin-off projects is our nursing assistant textbook. You may have heard in the news that CVTC used HER funding to fund the creation of this textbook. We're using OpenRN workflows and processes, but we purposely are using the same terminology and vocabulary as the other OpenRN textbooks. So not only is this, for those of you that aren't nurses, nursing assistant course is used for as an entry-level course into a wide variety of health professions. So we anticipate saving students in Wisconsin alone over $650,000 annually by providing this free resource, just because it is an entry-level course for so many health programs. And then finally, our most recent project called Next Gen RN is funded by WTCS Core Industry Grant. As I mentioned earlier, clinical judgment and those next generation style case studies are becoming very important as the NCLEX releases that assessment in April of 2023. So we're in progress of creating customized software using the ADAPT platform actually within LibreText to create these style questions with case studies that students can practice as formative assessments. So they're familiar with the way these questions look. They're far beyond your traditional multiple choice or select all that apply question. Really focuses on assessing clinical judgment. So we're excited to release those later in 2023, pilot them throughout 2023 and 2024, and then will be available for anyone to use as they are interested. If you have any questions, you can go to our website. As I mentioned, www.cvtc.edu/openrn. You can register to receive quarterly grant updates and access our OER materials, as I explained earlier. Anything you'd like to add, Vince? We have a few minutes left.
No, just wanted to say thank you for joining us, everyone.
Yes, thank you. And feel free to reach out with any questions that you have after listening to the presentation.